Hello, everybody, and welcome to another episode of Dental Disruptors Podcast. I'm Jake Larson, your host. I'm here with my co-host Clint Barry and a few new friends. We got Jay Hogan here and Dr. A with a new technology that they're going to share with us today. Jay, Dr. A, thank you for joining us today. We appreciate you taking the time.
Thank you for the invitation, Jake. We appreciate it as well. And we're excited to be on the Disruptors, and we are a company fully set on disruption and diversion, so I'm excited.
That's what we're talking about. Yeah, special shout out to our friend Sarah, who set this up. She introduced us, although Jay and I had met kind of in the DVIN, but this is the first time we've actually had a chance to talk. We're excited to learn about what you guys are doing. If you guys don't mind, Jay, Dr. A, let's start with Jay first. Give us just a quick rundown of your background. Just introduce yourself for our listeners so that those that don't know you can learn about who you are, where you've been, and we'll have Jay go first, and then Dr. A, you can go after him.
Sure, thank you. I've been in dentistry since 2007. Everything from private practice, acquisition, de novo, DSO specialty. Dr. A and I met 6-7 years ago, working together, and now we are pushing a new concept forward. I spent 12 years in the Army as well, did not do dentistry, so neither did I stay at a Holiday Inn Express, so don't ask me to pull teeth. But now we have what I think is a really cool and valuable business proposition for a lot of different practices and DSOs called Perfect Fit Ortho. It was Dr. A's brainchild, and I just tried to help refine it and make it scalable, and here we are.
Dr. A, tell us a little bit about yourself.
Absolutely, thank you. So I've been practicing orthodontics now for 20 years. And like Jay said, we connected about 8 years ago, and I've been pushing the vision of Perfect Fit, I'd say now for about those 7 years, maybe 8, maybe since the beginning. And then, once it clicked for him, he was able to see my view of it, and he just takes it to a new level. He puts in everything he's experienced, and here we are with a group of other disruptors. So thanks, guys. I appreciate it. Clint and Jake, thank you.
Yeah, awesome. We love to learn about new technology and see what's going on out there. That's why we started this, right? Was to talk about things like this. So let's dive straight into this. Tell us about Perfect Fit Ortho. What is this? What is disruptive about us? Give us the in-depth pitch that.
Okay. Well, I'll just start with the history. I'll start with the history so all the listeners can understand, because I'm sure they've all been through it in their professions. Smile Direct, we all remember when that came out, and I was an orthodontist, and as I was watching these orthodontists go crazy over it, I said, well, something's working. So I became a patient, and I said, let me see what's really going on. And, like a lot of us believed, it wasn't really the best at treating the teeth, but you know what, on the other side, they really took a step towards where AI is, or at least becoming, and they kind of opened my eyes to, well, orthodontics will always be about taking care of patients' teeth and alignment and occlusion, but there's another way to do it. We got to give people what they want, and they want efficiency, affordability, and convenience at home. So whatever we think as orthodontists, me included, we've got to kind of shift our mind to give our patients what they want. And so that's where we started tinkering and testing. And here we are. We created Perfect Fit Ortho. And, like I said, once Jay was on board, we were really able to elevate to new levels. And it's been great.
And I think the main disruptor, to your point, is that we understand entirely that it's not a standalone. We learned really early on that a lot of general dentists are trying to find ways to keep more of their patients under their own roof. They're going to do ortho. They want to do ortho. The challenge for a lot of them is they don't know necessarily how long it's going to take. They don't know enough to be dangerous in the sense of trusting whatever aligner manufacturer they use to do that design and setup work. And then it becomes a law of diminishing returns when they're seeing these patients every 4 or 5 weeks in the practice. So instead of fighting against the grain, we acknowledge that they want to do it, and we came up with the idea, we're not here to sell you an aligner. We never will. We're here to be your virtual orthodontist. So we help general dentists more quickly identify patients who could benefit from aligner therapy. We give them time estimates on how long it's going to take, what's going to be involved, so the general dentist doesn't have to worry about getting married to a patient and then it falling apart later. Our team does all the design and setup work. We help them sell it with financials, third-party software tools, we help them deliver the case in the sense of giving them advice and best use practices. And then we monitor and help them monitor their patients weekly remotely so that doctors can now say yes to more of these patients instead of referring them. They have an easier opportunity of getting the patients to say yes by offering them finances that make sense to the patient. They don't have to worry about their lack of understanding when it comes to setting up a case because we're doing all the behind the scenes work. And then once they deliver it, we're monitoring it. So I haven't trademarked it yet, Jake. I'm going to. It's going to eventually. My pitch is if you want to do more aligners, you want to spend less time doing it, and you want to make more money in the process, we're the perfect fit.
Nice.
Yeah.
So you say you're behind the scenes doing a lot of the orthodontic work. Does that mean that the dentist then gets less of a cut than, say, if he did some other aligner system? How does that work?
So the great thing is because we're aligner agnostic, and I won't name names, but we are aligner agnostic. There are a lot of aligner manufacturers that have come to us and recognize that this is an opportunity for them to have their GPs do more aligners. So depending on the aligner that you want to use, there are often times that our fee, inclusive of the aligners themselves, is less expensive than some of the larger aligner manufacturers that are in the country. So the doctor is paying minimal, if anything more than what they probably are paying now. And they're going to see that patient 70% less, but the patient's going to get to see an orthodontist or a dentist and an orthodontist every week. They can take their scans at home with their PJs on. They can be in Paris watching soccer. Doesn't matter. As long as they have a Wi-Fi connection, they can reach out and communicate. But the doctor doesn't have to see them unless it's necessary. So it also helps us. We can more quickly track a patient. Let's say Jake's in aligner therapy and he refuses to wear them. We're going to know within 2 weeks. Because when he scans, we're going to know they don't fit. We're going to know he's not doing what he's supposed to be doing. So we can make adjustments, right? In the Army, we talk about like adjusting fire. We can adjust fire with that patient's treatment in real time, as opposed to finding out 6 months from now that the teeth have not done anything that we want it to do. So it's a huge win for the patient, but it's also a huge win for the dentist because there's definitely things they would rather be doing than just checking aligner fit, occlusion, attachments, and elastic cooperation every 4 to 6 weeks.
And then, Clint, to answer your question, I'm sorry to interrupt. There's a small fee, and when you compare, what we do to other people in this space, which they're not identical, to us, because I like to say we're a little divergent, but the similarities, those similar companies, there's a little fee. Now, our fee, I think, is the smallest of all of them, because our goal is to become that orthodontist that helps the dentist, the primary caregiver, provide like top-notch quality aligner care. And we want them to take care of their patients. We want them to be the direct contact, and we want to be the orthodontic consultant that takes it the whole way. Not just setup or not just while in treatment, but from beginning to treatment planning to even, coming to an agreement on the case all the way through.
Okay. Yeah, see, because when I hear that and you're like this full, you're doing this consulting piece along with it, my expectation would be that you cost a lot more. But from what I'm hearing is you've built some technology that allows you to do this in a more efficient way. Does
incredibly
that
efficient. It's all literally about efficiency, and it's about speed. With the softwares that we use and the technology that we're using, doctors can get a chairside consult from us in 15 minutes. So imagine you're the doctor and you've got Jake in the chair for hygiene. By the time that hygienist is done with their prophy and he comes in for a hygiene check, you've got a treatment plan that you can talk to your patient about. You can tell them how long it's going to take, what's going to be required, how much it's going to cost, and how you can make it affordable for them. And there's no risk to our clients until they say yes, until the doctor says yes. So in theory, you could have a patient chairside, get the consult, present a treatment plan, patient says yes, signs and pays, you scan them, we do the setup, all the setup work. Then it comes back to you and you say, you know what, for whatever reason, I'm going to refer this patient out. I don't want to do it. There's no cost to you. It is the easiest way for general dentists and DSOs and small groups to have a lethal injection of top line revenue. And it becomes genuinely, and I would love this. You can find me on LinkedIn. Tell me if I'm wrong. It becomes the most profitable thing that a doctor will do based on a chair hour. If you have something else, you tell me. I would love to hear it because it doesn't exist currently.
Well, that's kind of where I was thinking with this. I mean, we talked to a lot of DSOs, right? And many are always looking for strategies where they can impact the bottom line of the practices that they're bringing on. It's a, Clint's shaking his head there. We had someone here in office, and he was talking about these different strategies that they're doing. And
how do we keep more of it in house? That was one of the strategies. Is like we look at all the procedures they're referring out. How do we keep more of it in house? And they weren't talking about just ortho; they were talking about all sorts of stuff. Like who do we need to bring in? But I mean, this sounds like it could be a big one.
Now here's why it's such a big one. Right? Go ahead, Jay. Go ahead. Well, I was gonna say, here's why it's so big. Is not only are these doctors bringing in orthodontists with clear aligners in house, but they're doing so while opening up chair time, not losing chair time. So that's the key shift here is you don't have to take up your chair time anymore to bring in these clear aligner cases. You actually get abundance in clear aligner cases and more open chair time to do other things, like maybe another specialist, maybe more implants, maybe a surgeon, maybe a periodontist, and that's the beauty of Perfect Fit.
Okay.
And so from an opportunity perspective, sorry about that.
Yeah. Okay.
Before I forgot, from an opportunity standpoint, think about this. The ADA says 80% of the population of the United States has some form of malocclusion, could benefit from ortho. GPs present to less than 20%, not treat, present to less than 20% of them. So if you're trying to find a way to increase revenue within your practice, we're not telling you to go find new patients. We're not telling you to do a huge marketing spend, right? We're telling you to present it to the patients who you already have. They want it. It's a matter of, are you going to offer it to them or are you going to send them somewhere else?
Yeah, that makes sense.
Yeah, that's super cool.
It seems like a no-brainer. I'm curious on like the technology side. Is this scanner independent? Can doctors just use whatever scanner they have, or do you have to have a scanner from you guys?
They can use whatever intraoral scanner they want.
For the STL,
we beg you to take scans. Taking impressions is kind of like having a rotary phone at this point in the game.
Yeah, no one wants to do that.
Any scanner, any aligner, we're entirely agnostic. And I tell people this all the time. If you want us to tell you what aligner systems we like most clinically, we're happy to share that. If you have an aligner that you already use and you like, we're happy to keep it to ourselves. We're never going to sell you an aligner. We're going to be your orthodontist.
That is super interesting to me. So it's like, I would have also guessed that you guys would have brought your aligner partner with you. But so it sounds like that part doesn't matter. You just want to help them keep this revenue in-house, and you have the efficient software to make sure that people are following the treatment plan.
Following the treatment plan, and most importantly, from an IP perspective, taking the software part out of it to some degree, anything that can be done with brackets and wires, we can do with aligners. But if you think you're going to take a scan of a patient and send that to Joe Smith's aligner manufacturer, and their warehouse of lab techs is going to get you that final result, that's how a GP does one case out of their comfort zone. It falls apart and they never do aligners again. Mm-hmm. On average, regardless of the aligner manufacturer, our ortho team is sending back these treatment plans back to the manufacturer on average 4 times before we are happy enough with the setup to even show it to the general dentist. So there's a lot that kind of goes into it. GPs think you scan, you send it to XYZ aligner company, they send you back a setup and you say, looks good, and that's where things fall apart. Because there's certain things that their software just cannot do. I'll give you an example. We have patients sometimes that have a lot of bite issues that we're trying to correct. And we will do a setup. A final setup takes us maybe 6 times. And we send that to the GP to review. And they'll oftentimes, when they first start with us, will send us messages back to say, well, the bite's still off, or that final tray doesn't look like the patient's in occlusion. And we have to tell them the software literally will not be able to show you that final position for this patient. They don't have the technologies to be able to do that. However, clinically, we know as we stage this, because it's driven by an orthodontist throughout, that we know where the final position will be. That's a huge difference.
Okay, that makes sense. And so what are some other things that cause you have to send things back? You when you say send back, it's just they're not actually printing the aligner and sending it to you, right? You're saying
just the setup of the case.
Model, right?
They send a digital workflow, first treatment progress. So here's what the aligners will do to the teeth. hypothetically, but usually that's not what is going to happen in the body, right? And that's going to have negative effects on the occlusion. And that's where the orthodontist comes in with experience, and we modify it, because you know what, the lab techs, they're not really trained on how to do it. And if you take a weekend course, you're not going to get the training. So I like to say I've been doing this for 20 years and I'm still making adjustments every few months with new little tricks, new little tips, just all kinds of things. So I don't expect anyone to know how to do it. That's why I decided to dedicate my time to do it, because I don't mind a dentist taking care of their patients. I just want to make sure that they can give their patients the best aligner care possible, period. And that's it.
Love it. That's so cool.
I want to ask you guys about the industry as a whole and how impactful this can actually be, just with a couple quick questions. So what percentage of dental practices would you say currently offer some kind of in-house solution like this at all? Or on the flip side, what percentage are outsourcing it? You guys have any idea with those numbers? What would you guess?
When you say outsourcing,
Like
Dentist
giving it,
referring.
yeah,
He means
referring.
referring.
Yeah, sorry.
Oh.
Yeah, referring. Well, what percentage
I will
is
say
in-house
this.
versus what's referring?
I would say probably at least 60% of GPs have on their website that they do clear aligners.
Okay.
I would tell you the GPs who are referring out anything out of what we call the shallow end of the pool, that 6 to 8 month range, I can tell you when we ran brick and mortar orthodontic practices, every day we were getting, and that was really the turning point for us, Jake. We were getting all these cases, and we said, what if we taught you how to do it, provided you the systems and the softwares and the workflows so that you could do these yourself? Just make sure, Dr. Jake, Dr. Clint, that you refer all the hard stuff that you don't want to do to us after we teach you our program. Within 6 months, they had stopped referring to us at all, and they were using this system entirely. That was really one of the motivating moments for us to pivot and say, you know what, we can help. Because again, GPs are referring out the majority of their cases. And unfortunately, and I might get drugged through the weeds when I say this, it's a one-way relationship. Most orthodontists are not referring a lot back to GPs that aren't already patients of record for GPs.
Yeah.
So all we're doing is allowing them, and again, patients don't want to go everywhere. My son went through ortho 15 years ago. Once every 4 weeks, I had to take him out of school.
Like I said before, we hear it all the time that people are looking for those ways, especially on the DSO side, to make those improvements to the bottom line, and what a powerful way to do it. Clint and I had an argument on this podcast a few weeks ago about an AI strategy, right? Once this undisclosed update here comes out, there's another component to that.
I can't wait for the digital Dr. A. That's going to be awesome.
Doctor. I like that. I like
Jake,
that.
you get a doctor, that presents, he does 4 cases a month, let's say. That's an extra $250,000 of revenue per year. By just offering treatment to the patients who have it. And
sometimes I think that this gets convoluted, that in practices people feel that presenting things is salesy, right? And they don't want to, but in reality it is care. It is giving.
Who doesn't want straight teeth?
100%.
Well, and here's the other misnomer.
Well, it's not just that, Clint. Go ahead, Jay. You're probably going to say what I was going to say.
Oftentimes, and I wish they would stop in general, oftentimes doctors put ortho treatment or clear aligner treatment under their cosmetic categories. And the last thing that people should think about with ortho is cosmetic. If you think about, patient's ability to breathe correctly at night, if you think about anytime a hygienist has a patient in the chair and says, do you notice that you have food compaction here? Or do you notice that it's hard to floss here? Or do you feel this clicking? Or do you see how you're wearing this enamel or this occlusal side? It's because your bite's not correct. It's because of this. It's because of that. Again, 80% of the population can benefit from ortho. The days are over, and I'm getting older by the moment, that, when I was a kid, I asked my parents, hey, why don't I have braces? Oh, you just have a gap. That's fine. You're good. No, it's not. It was a miracle I could bite an apple. I think we've come a long way from an education standpoint, and I think access to care is much easier now, right? When I was a kid, it was either cash, check, or credit card. Now there are a multitude of ways to make things affordable for patients, and almost everyone can benefit from it. We have to get out of the mindset of, I'm fine with my smile looking crooked. And that's not the issue, right? It's functionality.
Yeah.
Love it.
Really, really cool.
This is great.
Really fun to learn about this, guys. Thank you so much for taking some time to share this with us and with our audience. Real quick before we finish, Jay, Dr. A, what would be the best way for people that want to learn more to get in touch with the two of you?
I would
come
say
visit
go
us
to
at the website.
our LinkedIn, right?
Yeah.
You can hit us up on LinkedIn, perfectfitortho.com/get started. Facebook, Foursquare, MySpace. No, I'm kidding.
Foursquare.
The best come on perfectfitortho.com and just go ahead and schedule something. It's real easy to do. 15 minutes. We'll go over everything. If it takes 30, that's fine. We're here to help you, dentists, take the best care of your patients, do the best results with clear aligners. And then, like Jay mentioned earlier, you guys are going to see that reward in production. And it's going to come real quick, real easy, and it's going to come with open chair time so you can even make it more abundant.
Yeah.
It's pretty incredible.
That's awesome. Well,
And then if I want to do Perfect Fit Ortho, you just need to give me a list of doctors in Utah that are signed up, and then I'll go to that one and get it done.
Sounds
Love
like
it.
a plan.
Man, hey, hold on. Before we go, Clint, explain to me why everyone that lives and breathes and is in dentistry is moving to Utah. You guys took Sarah Ruberg. You're taking them on a daily basis. What has happened?
Beautiful state.
Yeah, it depends on what you like to do. If you have hobbies that are outdoors, mountain biking, hiking, it's one of the best because it's so close from a proximity standpoint. And then it's hard once you move here to leave the mountains. The mountains are just so close. Like, I love Denver. It's an amazing city, and the mountains you can see in the distance, but Salt Lake is literally like in the mountains. It's like right there. Ski resorts are 15 minutes away. It's been pretty great. And then Dentrix was invented here, so that started the whole thing.
Well, there you should have led with that.
Dentrix,
Yep.
Weave, Dental Intel. There's so many dental companies here. I think everything just compounds.
I believe you got the essential oils out there too, right? Essential oils.
oils,
big.
you name it.
Yeah.
Yeah.
Data
Yeah,
isn't
if you're
data
interested
getting
in
stored there
multi-level
now?
marketing, you can do
Make
really
it
well
killer.
out here. You won't have any friends left, but you could do it.
Yeah.
All right.
Just make sure you tell everyone it's not a pyramid, it's a funnel.
That's right. Oh man,
That's awesome.
kills me.
Oh, you two are great. Thank you both so
Thank you,
much for
guys.
joining us. Once we'll do a follow up to this once Clint
Okay.
gets his perfect fit ortho.
I
Nice.
need this one,
Sweet.
man, right here.
Yeah, see?
Love it.
Oh, easy. We got you.
Yeah, not too bad.
All right.
Awesome.
Thanks, guys.
Thanks.
Appreciate it.
Yeah.
See ya.